Before we start, I would like to ask your help to hit the like button, hit the subscribe, and smash the bell. Smash like hawk. Hi everyone. I have to ask you guys to mute yourself. Yep. Okay. We'll start in a while. Okay, just a bit of hi, good evening everyone. Okay, I think you guys know me already, right? So this is my free basic trial Zoom model. So it has a limit of 40 minutes, but that day when I use for my casual Zoom meeting, it actually can go above 40 minutes. So we see how it goes. If really can go above 40 minutes, then you guys can ask the question, and you all can ask the question in the chat box. All right. Okay. Hello everyone. This is my first time hosting Zoom. So if there's any shortfall, maybe you all can give me feedback later on. Okay. All right. In the sharing today, I have some question as well for you guys. If let's say when I ask the question, then you all can interact with me by typing something in the chat box. So some of the question will be very simple only lah. Like you have multiple MCQ multiple choice. You can see A, B, C, D, and you can choose A, B, C, D. Can you guys see me? Okay. Yes, good. All right. So, yeah. Very long. Okay. Yeah. Every time in cap, you all don't see, right? So this is your opportunity to see me without my cap, my mask. All right. Okay. Basically, now pandemic so a bit worried about going to the barber as well. Okay, in one more minute, we will start. Okay. So, yeah, I will talk for around 30 minutes. Then the last 10 minutes, you guys can ask questions, and then I will just answer. If you guys have any question, you all can just type in the chat box. If I see it, then I will answer. If I don't see it, then maybe I will go back and answer. Okay. All right. Okay. All right. Quite a few here. Wow. Okay. I thought only a few people will come. Okay. So a bit of introduction. We have our antenatal class. If you see our package, this leaflet from the logo online. And then usually we will have the class together with other disciplines like pediatrics, physiotherapists, dietitian, midwife. So from this time, I couldn't actually get so many people because I'm one-man show, So hopefully, maybe by the next class, I can get more people in. Then perhaps it will be more comprehensive. Today's talk, I will include some input from the dentist, Dr. Karen Cheong, and then with the genetic counselor, Ms. Tiong Shinin. Okay, Ms. Tiong will also she won't talk to you, but she already given me the info, so I'll just go through, and then everyone get some info from there. Okay. All right. If you just came in, please mute yourself. Okay. All right. So welcome everyone. So today we'll start the Trilogy of Pregnancy 1.0 baby upload. Okay. For this upload, basically I'm talking about antenatal. Means that from the point you are pregnant just until before you deliver. Okay. So I'm going to tackle two questions. Do I need this antenatal checkup? Okay, is my baby okay? All right. So do I need antenatal checkup? First, if you can see from this chart, you can see that your pregnancy is 9 months. first 3 months is called first trimester, second 3 months is second trimester, third 3 months is third trimester. So the first trimester is the time when you feel a lot of this very irritated, very annoying symptom like vomiting, very lazy, sometimes you feel very dizzy, okay? So just like the movie, right? Okay. Then on the second trimester, actually I call this the honeymoon, okay? Why? Because you got no more symptom and you feel better, okay? And then the third trimester is where you carry a big baby, and then it's very heavy and you have all this pain coming in, the back pain, sometimes the pain over your thigh there, all right? So all this pain is normal. So usually patient will tell me, doctor, I have this pain, then I will tell them, okay, you can use, if very too painful, you can use Panadol. If it's just minimal, then maybe you can do some yoga or stretching. Then you can and at the end, there's not much that you can do until deliver. So maybe you can keep a diary. Some people, when they keep a diary, they write, then they feel better. Okay. So these are the follow-ups that I've listed down for first trimester. So it's the first is the 5, 8, and 12 weeks. Okay. And you can see I highlight those important ones in pink. Okay. So it's like 12, 20, 36, and 40. So these are the, 36, then 37, 38, 39, and 40, okay? So these are the few weeks that is very important for antenatal checkup, especially with a consultant obstetrician or specialist obstetrician, okay? The other weeks, you can see a normal, the GP, general practitioner doctor, which usually if they can do the ultrasound, they can scan for you for 5, 8, 16, 24, 28, 32, okay? And then when it's near to delivery, then need to do weekly from 36 week onwards. Later I will explain, okay? So, all right. So I will go through one by one. Okay, so this is the chart that you guys see when you all first come follow up, and I will explain, but not in as detail as now, okay? So as you can see, I also highlighted that the 12 weeks is where we would do a scan, mainly for genetic screening, okay? And then at this point of time, because I need to upgrade myself, I actually go for detailed learning for detailed scan for first trimester. So for structure, I can start scanning for 12 weeks. And then I will do this pre-eclampsia screening. Pre-eclampsia means that there's a condition in pregnant lady where you have high blood pressure and it's so high that you nearly fit. Okay, eclampsia is fitting in pregnancy. Pre-eclampsia means before you fit. Okay, so this is what we screen the condition that may cause you to fit. Okay, and then at 12 weeks, usually I would also do the blood test for mothers. We call antenatal screening. We screen for your hemoglobin, we screen for all the viral infection like hepatitis B, syphilis, HIV, okay? And then depends on your condition, sometimes I will add on some thyroid blood test or vitamin D, okay? All right, and then at 20 weeks, we have the detailed scan. And then subsequently is the growth scan, means that we look at the baby growing, okay? So during antenatal, these are the 3 things that we need to check for the baby to see whether baby is okay or not. First, the genetic at 12 weeks, okay, and also the structure at 12 weeks, the major structure. Second is the structure at 20 weeks, and then after that, 24, 28, all this is the growth of the baby. Okay, I will go in details. Okay, all right. So for 5 weeks, what is important is when you 5 week scan, you need to see the sac. So this is the sac. So the sac is very round, like a moon. Okay, very circle. Okay. So the sac is inside the uterus, and this is very important because if the sac is outside of the uterus, then it's an ectopic pregnancy. Ectopic pregnancy means that the pregnancy is not in the womb. Okay, it's outside. So if outside in the womb, the pregnancy cannot grow. When it cannot grow, it will rupture. When it rupture, it will bleed. When it bleed, then you die. Okay, so it's very dangerous. So those who are 5 weeks, usually 5 weeks, why? Is because after you miss your period is 4 weeks. Then 1 more week you miss, then you check that's 5 weeks. Okay, Then subsequent scan is at 8 weeks. So this 8 weeks at the time is where it's very nice. You can see there's two round globular thing, and then you can listen to the baby heartbeat, or you can see the blinking sign. Okay, that blinking is the baby heart. All right. And then at that time also we do dating. Dating, not that you go out now dining in and you dating. Okay, this dating means that we want to date the baby. Means that when we measure, we will see what is the due date by the ultrasound. And if the difference from your calculation from your last menstrual period, if it is the same or it's a difference of less than 7 days, we follow your last menstrual period calculation of due date. But if it's more than 7 days, then we will sometimes do another scan and we see is there any discrepancy, and then most likely we'll follow the ultrasound due date. That's why we call this revised estimated due date. So it must be based on the early scan around 8 weeks to 12 weeks. Okay, all right. So no question, right? Okay, good. I can see the chat box very empty. Okay, all right. So the third one will be the 12 weeks. So the 12 weeks, we have the mom's blood test, and then we have NICC, or then we have detailed scan for the baby, and this pre-eclampsia risk assessment. Okay, so the NICC would be all right. So the NICC is where we, through last time when pregnant, there is a test that, you know, when you're pregnant, then people will call this amniocentesis. They will take out some of the fluid from the pregnancy and they will check for DNA. So this was like, you know, 4 and 5 years ago, but now they have something called NICC, which is a non-invasive chromosome check. Okay, all right, or some they call it NIPT, non-invasive prenatal testing. Okay, mainly is because some of the DNA that's from the baby, it goes into the vessels of the mother. Okay, and then when we take the blood, we can extract out some of the DNA and we can test for any chromosome abnormalities. Like those most common is Down syndrome. Okay, the chromosome 21 have 3. Okay, so this is the advance that we can have now. Okay, of course the price is a bit expensive, but last time because the blood cannot be done in Malaysia, we need to send out to Hong Kong or Australia. It costs around 3,000 plus. But now we bring in the machine and now it's around 1,000 plus. Okay, but because of this test, we know very detailed or very accurate, 99.9% that this is whether this is so whether this baby has any chromosome abnormalities. Okay, this is what I call as genetic screening. Okay, all right, I'll talk more about genetic screening in a while. Okay, and then before you go for the blood test, okay, I'll do a detailed scan. Okay, this detailed scan is for first trimester. It's the different from second trimester. So for first trimester, the detailed scan is for bigger abnormal structures. Okay, for instance, some baby they have no brain. Okay, anencephaly. Sometimes they have no cranium, acranial. Okay, so all this you can detect from the first trimester, or even some structure like if you baby have any cleft palate, means that it's not the lips but the palate inside. Okay, we can also detect by looking at the small triangle of the baby at so small size. So for this first trimester detailed scan, all right, I only recently start doing it. It has 60% of accuracy. Okay, and then for those who come to me recently during follow-up, if you are from 12 to 14 weeks, I will take 4 times of blood pressure. Okay, so left hand twice, right hand twice, and then I will do what we call as a uterine artery Doppler. Okay, so this Doppler will see whether your flow of the uterine artery. Uterine artery means is the blood vessel supplying to your womb. So if the flow is too little, so it means that you're higher risk for this preeclampsia, the high blood pressure during pregnancy. Okay, all right. So okay, sorry, the genetic screening I talked too much just now. So basically, genetic screening is to see whether your baby has any genetic abnormalities. For instance, if you see this superhero show, I initially want to put those genetic abnormality photo there, but then all pregnant lady looking at it, not nice lah. Okay, so as you can see, the superhero or the Guardians of Galaxy, all these, you can see some of them, they have genetic abnormalities. For instance, the Hulk, okay, Spider-Man, and some other characters. Okay, so basically we want to look at the genetics. Okay, so first one is the NICC, where we take the blood of the mother. Okay, and then from there we extract the DNA of the baby and we screen for all the chromosome abnormalities, and also we look for we can also look for confirm the gender. Okay, so the cost now is around 1,003, but it may fluctuate depending on the labs. Okay, because this is we send to external lab. All right, so we're doing the blood test NICC instead of the amniocentesis, which is invasive. All right, so let's say you couldn't afford or you're not keen to do this test. There is another it's not gold standard, so it's slightly below, like silver standard is I do this knuckle translucency or neck thickness. This is actually part of the detailed scan as well. Okay, so from there you can see that if it's very thin, then it's normal. If it's very thick, then it's abnormal. As you can see here, okay, beside looking at the nuchal translucency, the NT, I also can see the nasal bone, I can see the midbrain, I can see the palate, I can see the nasal tip. Okay, so all this will also show me that there's any very gross abnormalities with the baby. So this is what we mean that this is part of the first trimester detailed scan. Okay, all right. And then moving on, so after the 12 weeks, 12 plus 4 is 16. Okay, so at 16 weeks is usually the non-important follow-up, but for patients sometimes they are very happy because at 16 weeks is where we determine the gender. Okay, to determine the gender, it depends on the baby whether the legs open or not. Same lah. You want to see whether what's your gender, I need you to open your legs, right? If you close your leg, I cannot see your gender, right? Okay, so as you can see here, there's two different genders. So for the boys, you can see there's a, we call this there's a cylinder, and then for the ladies, the girls, you can see here like a burger sign. Okay, so yeah, so sometimes I tell patient, oh, this one is the cuckoo bird lah. All right, so that day somehow the patient agree, I just type in cuckoo bird there. All right, then some of the patient later on saw I write cuckoo bird, they asked me to type for them also. Okay, but this one is the how we look at the gender. All right, but if you have already done the NICC, is more accurate than the scan. Okay, the scan is only around 85% accuracy. For the gender, the NICC is 99.9%. Okay, all right. So at 16 weeks or so, sometimes I would ask the patient whether they want to go for any, see the physiotherapist to learn about pelvic floor exercise. Okay, so pelvic floor exercise is like Kegel exercise. When you do it during pregnancy, it will prevent you from having this womb prolapse, falling down after when you get old, like maybe 50 or 60-year-old. All right, and the second thing is to go for this dental checkup. Okay, all right. So now I will pull myself out from Dr. Low. I will become Dr. Cheong. Okay, so these are the top 5 questions about dental assessment in pregnancy. Okay, all right. So the first question was skip. Okay, so how does dental health affect pregnant ladies? Okay, sorry, I didn't memorize the thing. All right. So basically, when you are pregnant, it will have some physiology changes, okay? And then because of the hormone increase, okay, the estrogen, progesterone, then you will have some gum inflammation, and sometimes your gum will be swollen up, okay? And this sometimes it can be have exaggerated inflammatory, okay, a response to local irritants. So sometimes like if you have some plaque or calculus, then you have all this infection and inflammation. Okay, one of the most common signs is when you brush your teeth, you have bleeding. Okay, so if you have that problem, you go and see dentist. Don't worry, you won't die of bleeding. Okay. Then for the baby pula, all right. So if you have a very poor dental hygiene, okay, you will also cause your baby to be delivered earlier, what we call as preterm birth. Because from the New England Journal of Medicine, it shows that some of the gum disease, it causes some hormonal or this cytokine, one of the chemicals in body to change, and this would lead to your womb being stimulated earlier, and then you deliver your baby early. So a good oral hygiene is very important. So make sure you take care of your dental hygiene, your teeth, all right, during pregnancy. Okay, next. How is a prenatal dental assessment done? Okay, basically the prenatal dental assessment is similar to non-pregnant as well. First, you come, they have an oral health history. They'll ask, do you have any swollen, or when you're pregnant, how much you vomit, and sometimes how often, when was your last dental visit. Then the dentist will open your mouth and check for any swollen gums, bleeding gum, any decay, all right, and any signs of infection or trauma. Okay. And when is it suitable for dental checks? For me, I would usually ask to go at 16 weeks. Why? Because it's a honeymoon time, the second trimester, because you don't feel like vomiting. Okay, you don't want the first trimester, you want to vomit sometimes. Later, Dr. Karen suddenly check for you and you come out, then not nice, right? Okay, so usually any gestation is suitable, but for me personally, the best would be the second trimester. Okay, and then if you need to do any procedure, usually second trimester, if not after delivery, because during pregnancy a lot of your blood vessel is swollen. So when it's swollen, it's easier to bleed. So we think better after delivery, or maybe in the second trimester if it's very, very urgent. Unless it's very, very severely urgent, cannot tahan already, then during the third trimester, we'll still do it. Okay, the dentist will do it, not me. Sorry, not we. Okay, the last one, sometime before the procedure, we need some X-ray. So is this X-ray dangerous? Actually, it's not dangerous. Okay, actually, X-ray for the tooth is down here and it's beam up. So the beam is going out, and when you have some shield over your baby, it won't affect the baby. Actually, a lot of people scared, X-ray will turn my baby into abnormal. No, all right. As long as it's just a single shot X-ray, is not very highly radiation. Okay, there's no high radiation to the baby. Okay, so everyone good with the dental question? If okay, just type okay to show that you're not sleeping. And then I'll move on. Yes, okay, good, all right. Okay, so now I'll pull myself out from Dr. Karen, and then I'll go to the next slide. Okay, so these are reference. Okay, now answer question time. If the baby is genetically normal, is the baby 100% normal? Yes, no, not sure. Oops. Okay, which one? A, B, or C? Can you ladies answer the question? B, no. Okay, Jamie answered no. The other people still thinking? Cannot think too long. I got limited basic, so we can mind and thumb first. Okay, we got B, we got C, we got B, CB, CB. Okay, all right. CB not a good things to say. All right. All right, so the answer is no, okay? So if it's genetically normal, the baby not necessarily 100% normal yet, okay? Why? Because we need to look at structural, okay? Actually, the clue is there in the first trimester, the structure, okay? The first trimester detailed scan, we look at structure. Second trimester, we look at more detailed structure, okay? The example is this Iron Man. You guys know, right? Iron Man, his heart is away and he used something like energy source. Okay, I forgot the name of the energy source. Okay, all right, yeah. So most of the answer is B. Okay, so for structure, the detailed scan for second trimester is similar to the first trimester, but it's more accurate or it's more obvious. Okay, because the baby is bigger And then we do it at 18 to 22 weeks, most likely. Usually I will do it at 20 to 22 weeks, okay? All right. Yeah, someone raised hand. Later I will answer. Maybe you type the question in the chat box. All right, Jane. Okay. So from the detailed scan, why we do at 20 weeks is because at that time your amniotic fluid, the fluid inside the womb is still a lot. So through the fluid, the ultrasound can see better. Because if you do too early, the organs is not well formed yet. If you do too late, it's very cramped up. We cannot see the features. Okay. So ultrasound is also, we need to the baby to be a bit relaxed and open to the water so we can see. So some people, they thought that if we do ultrasound can see everything. No, not like that. Okay, it need to be not so cramped up to see. Okay, it's just like I'm looking at you, you're looking at me. If I like this, how you want to see my face, you cannot see my face. All right. So ultrasound is also the same. Okay. So here I have a short video that you guys can watch about details. All right. So this is the head, right? This video is from my friend, so there's some difference from what I do normally in the scan. I will usually measure the brain. The ventricles is the fluid inside the brain. Make sure that it's not too much. Okay. And then sometimes we look at the toe, the brain. Okay, this is also the blood flow in the brain. Okay, and then we look at the eyes here. Okay, can you see the arrow that I point? Okay, and then this is the ND, the nasal bone. Okay, so if the baby have no nasal bone, then we think of some syndrome. Okay, and sometimes we look at baby yawn. Okay, actually the baby is not yawning, swallowing the water. Okay, and then here you can see the lips, the nose, all right, and the lower lips, right? Okay. Then next we look at the spine. Okay, this is the spine, backbone. So the backbone they see really two in the body, like this dimension. Okay. Okay. So yeah, I don't do the color enhancement. Okay. Then I think the most important part of the scan is usually the heart, because you need to see the 4 chambers. Because the heart, if the baby have any heart structural abnormalities, it need to be addressed immediately. So this is the left chamber, the left side of the heart. This is the right side of the heart. Okay. So I will look at the 4 chamber and both right side. Yeah. So this is with the color enhancement to show the flow. And this is the aorta, the biggest vessel to carry oxygen heart body. Okay. Dr. Arch should name one of the vessels as well. And the 3 vessel view, at the 3 vessel in one. Okay. In real time, you can see the heartbeat, you look at the beating heart. Okay. So whether the picture is clear or not, sometimes depends on the thickness of the tummy. Okay. Because if you're very thick, sometimes the penetration is not nice. So if those with very thin layer of fat there, then you can see the features more clear through the ultrasound. Okay. So this is the fetal part. Okay, then we look at the tummy. Right, tummy, we look at the diaphragm. Diaphragm is the lower layer of the lungs. Okay. Sometimes some baby they have hernia, means that the layer is not there, and will come out from, right? See, this is the diaphragm line. See the left side of the line. Okay, and the kidney, alright. This kidney, you need to see both sides and make sure the kidney is not swollen. Okay, if it's swollen, sometimes a bit is normal because of the stagnation of the urine. But if it's too much, then we need to look for other things. So this is where the urine in the back okay? And then we measure the whole abdominal circumference, the tummy. Yeah, and here we look at the bladder, okay, another black, and the plexus, the muscular, and this is the cord insertion, okay, with color Doppler. Doppler means is the scan which we see the flow. Okay, and then this is the healthy coil of the cord, okay. Then we look at the limbs. The hand, arm, okay. So for detail scan, usually, okay, this is cradling of the cord, the hand holding the cord. I mean the baby holding the cord. Okay. This one we don't usually look at it. So I mean this is just a coincidence that look at it, right? Usually you look at the hands, okay, the forearm, okay. Fingers is not part of the detail scan, but if you can see it, then you can see it, right? Usually, if the arm, forearm is normal, the finger is normal, and you can see the movement of the hand. Okay? And leg, you see the thigh bone, the chin, and the feet. Okay? And usually, we need to measure the long bones. I will measure the thigh bone. Humerus is the arm, okay, all right. The feet and bones. We don't do measurement. This one is too detailed, right? This one is the blue means the baby. Okay. All right. So, okay. So detail scan. Then after that, you have 28 weeks and 32 weeks. At that time, some people will ask me whether can do the 3D 4D scan. Okay. So the 3D 4D scan is just to look at the features, okay, of the face, but there is not really a need for it medically. Okay. Basically, for you to see very nice, maybe you can put in your Facebook or your Instagram, okay. And then some people will just look at it and say, "Oh, I look like father or look like mom." Okay, but this is just I mean for you to have a pregnancy experience, but not really required medically. Okay, all right. Okay, then from the 20 weeks onwards, we have every 4 weeks, the 24, 28, 32, and 36. So you can see the first picture here is 24, the second is 28, then it's 32 and 36. Okay, so you can see that slowly you cannot see the whole baby. Okay, sometimes patient you ask me, "Doctor, I want to see the whole baby." Is like, if your baby so big still can see the whole baby, then it got problem already. All right. And then some patient, of course, they follow up under other doctors. And then when you first trimester, second trimester, can see very clearly. So when they come and see me at that time, already near third trimester, and when I scan, you know that it's not so clear because baby all cramp out. And they say, "Hey, doctor, how come your scan not so clear?" It's not because my scan not so clear. It's because baby already grown, and then it's all cramp out, and we cannot see very clearly everything. Okay. But of course, the vital things we can see, can measure the head, the tummy, the legs. All right. Okay, question 2. If genetically normal and structure also normal, is the baby 100% normal? A is yes, B is no, C is not sure. So what is your answer? Wow, 30 minutes already. B. Wow. C. Okay. B. Alright. So, Angie is here today with us as well. Okay. So, most of you guys answer B, and that is correct. Okay. So the next things I want to address is my baby okay? Alright. Because every time the patient will ask me like, is my baby okay? Is my baby okay? So sometimes we need to be very clear like, okay, now you are 5 weeks, I scan, the baby is just a sac. If you ask me the baby okay or not, yes, at this point it's okay. I cannot guarantee the other points because we need to look at it grow. Just like if you when you are small, right? When you are primary school, people ask you, you okay or not? We don't know, because whether it's primary school, okay lah, I'm doing fine in primary. How I know whether I'll be doing okay in university or maybe I don't go university? So these are the stages that we go, all right? So when we go about is my baby okay? First is look at genetic. Is the baby genetically okay? Then we look at first trimester, we have the NICC, the chromosome check through blood test. And if you don't do this, we do the nuclear translucency, all right? And we can see the risk for Down syndrome only, not for other genetics, okay? Second is the structure. Structure means we look at the detailed first trimester and the second trimester detailed scan, all right? The first trimester detailed scan, we detect abnormality up to around 60 or 66%. The second trimester maybe up to 85%, but it's not 100%. Why? Because some of the things either is too small, okay, or it's color. Color means that, for instance, if your baby have a mole or the birthmark very big, but from scan you cannot see because it's color. You know that ultrasound is black and white. Okay, and then is my baby okay? Wait, why did it hang? Okay, all right. The third one is the growth, all right, to see the baby growing. So sometimes if let's say the baby stop growing, then we must consider whether to deliver the baby earlier, okay, and give something to mature the baby's brain, to mature the baby's lung before delivery. So this is why the growth scan is important, but it can be done in other clinic, the general practitioner, and if they detect the growth to be slower, they can refer to the specialist. And of course, beside the genetic structure growth, after the baby deliver, we need to test, okay? What we test is sometimes hormonal. The routine one we do is a thyroid G6PD deficiency. Okay, these are two hormones or enzyme that we test, very basic, okay? Even in GH, you test this. And then under our the hospital package, you have a newborn hearing test. For this newborn hearing test, I will try to get some information and maybe some person to speak in my next antenatal class. And the last one is the new thing that we started screening in this hospital, but actually this has been screened in other countries. It's a nationwide screening. It's called inborn error of metabolism. Okay, so I'll pull myself out. I'll be Miss Tiong now. Okay, so what are the top 5 questions on this inborn error of metabolism screening? Okay, give me some time. Let me scroll and see. Okay, so basically, we'll be asking me what is this inborn error of metabolism screening. Okay, so what is it? Oh yeah, some call now. Okay, so basically, it's like in your body, you have some chemical process that turn your food into energy, and then it also removes the toxin from your body. So when you have a problem with this enzyme or this chemical, then the baby will have problem. Okay, some problem will be a bit mild, like cannot grow, okay, or have poor appetite, poor energy. But some will be very terrible. Some may actually cause some physical or mental disability and may cause death. Okay, so what is the purpose? Okay, so this purpose of doing this screening is that after we screen, we detect, then we can treat, okay, or we can prevent something from happening. Actually, the G6PD deficiency is one of the IEM very basic screening. It's like, let's say if you have this problem, you cannot take some food Okay, if you take that some food, then you cause some major problem in your body. So this is why we do this test, is because to detect, so that we want to minimize or to prevent death in the baby. Okay. So you'll be asking, so is this suitable for my baby? Actually, this kind of inborn error metabolism disorder, there's no like, it's not obvious from inherited. Like you see your grandparents healthy, you also healthy, but you can be carrying a defective gene in your body, and then you inherit to the baby. 1 in 3,000. 1 in 3,000. Wait, I just close this. Someone is very desperate calling me. Later I'll call back then. All right. So 1 in 3,000 newborn have this inborn error of metabolism. Okay, and then it can affect anyone regardless of your age, okay, your gender and your ethnic. All right. So if you want to be safe, better to do this screening. After you deliver, Ms. Tiong will come and talk to you, and then you will decide better whether to do it for your baby. All right. So how does your baby get screened? Very easy. Okay, you will just poke a few like dot on the baby's heel, the baby's leg. Then you'll just take out some blood and will blot on the paper, and this paper will be sent to the test. Okay, the baby will feel a slight pain, okay, but not very painful. And usually we do it on the first few days of the newborn after at least one feeding. All right. And the last question is, what does the screening result tell? Okay, if it's a within normal limit or negative, means that the baby is very, very low risk of having this problem. Okay, so this is basically a screening test. And then if it's positive or presumptively positive, it means that baby have high risk of having this IEM. So don't, sorry, all right. So if let's say the test is a positive, doesn't mean that the baby have positive, okay? It just shows that it's a higher risk. So you need to bring the baby back to hospital for a confirmatory test. Okay. So that's all from the information from Ms. Tiong that I'm presented to you guys. Okay. So last question of the day, question 3. Okay. So this is the end of sharing. Any question? Yes? No? Just smile and clap. Or this one is last time I used for the physical antenatal class. And last, still sleeping. All right. So you guys have any question? You all can type in the chat box. Or we have 23 participants today. All right. Now only I go through. Okay. Wow. Quite a lot of people. Last time when we have antenatal class, a physical class, I think we have maybe usually 1, 2, how many couples? I'm not sure. I think usually we have like 8 couples. Here I think we have 23. It's quite a big number. Okay. All right. Any question you all can type in the chat box, or you want to ask, then I will unmute and show the video for you guys. Or 8 or 10. Okay, Angie is the organizer for this antenatal talk, and we are trying very hard to get the physical. But I mean, the physical class is not possible because now it's pandemic. So we try to get the online one. So now at least I'm doing something. So because sometimes, when you come for clinic, very limited time, and then I don't want to keep on repeating. Maybe nice, so I can talk to everyone. Then we can tell everyone in one shot. Okay. So okay. So everyone smile and clap. No question. Typical Malaysian. All right. Or maybe I talk very detailed already. Okay. Got one new message from Yishin. Since I did scanning under Dr. Lo Liao, do I still need to go KK? All right. So this KK is actually, we call this primary care. It's just like you're doing a scan with the GP as well. All right. So primary care, this is government side. Okay. The thing is that if you already follow under me, technically you don't need to go and see the government side, all right? But if you can see the government side, the benefit is that after you deliver, they will come to your house to visit. And then just in case, if let's say you have any real complication in pregnancy and you think that the cost may be very high. For instance, you need to come for preterm birth. Preterm birth, we don't know baby how small. If too small, sometimes baby need to go to an ICU per day is around 5,000 plus, and you think you couldn't afford, then we will refer to GH. But if you refer to GH, you don't have any, any follow-up from KK. Sometimes there is slight resistance, okay, but usually it's okay. So I would ask you to go for follow-up with KK as well, so that you have like a bit double. There is another channel where they will check you for other things. Of course, the check for them is sometimes very thorough, and I would think that it's too thorough. Okay, so if you can go to Clinic Kesihatan for follow-up. That would be a good thing as well. All right. Okay. So yeah. Do I answer your question, Yishin? Okay. 감사합니다. Okay. Any other question? Yeah, sometimes the KK, they know that you are in private, so they ask you no need to come, because to them, they scared that there is some, I would think that they would think that, okay, maybe we don't confuse you lah, because sometimes they have their own scan, then we do our scan, then they become confused. But actually for me, no. I think it's better to be, we can cooperate together. It's like first, they are the primary care and the secondary care. So just in case there's anything, we can counter check each other. You're not tired, Yeah. Sometimes, yeah. Last time, I think now some of the Clinic Kesihatan, they are okay, because I spoke to their bosses, the the family medicine specialist, said they're okay with following up, because they would prefer you. And then like after the blood test I've done, they would just put it there, and then they would just record it. But some of the KK last time, they used to retake the blood again, because I don't know, they don't trust our blood test or what. But then after I've spoken to the family medicine specialist, they are okay with it. All right. Yeah, sometimes you can just skip like 1 week, 1 month there, and then another month here. Yeah. Okay. So Jamie has a question about GBS. So this GBS is a group B streptococcus, means that it's a kind of bacteria that looks like a cylinder like that. All right. So this GBS group B streptococcus is dangerous when you deliver, because it causes harm to the baby. All right. It may cause some lung infection to the baby. So some of the doctors, they would just screen everyone. Okay, means that they would check and do the pap smear and take a swab. Okay, but the thing is that GBS, out of 4 ladies, 1 lady will have. And then when you swab, doesn't necessarily that you swab everything, the result will come out. Some people you swab negative, but actually she had GBS. So even no matter what, the baby will be properly checked by the pediatric and make sure the baby doesn't develop any symptom. So for me, if let's say you have very severe symptom, like you have a lot of discharges, very itchy, then I will test. Because at that time, maybe if you have GBS, there'll be a lot of GBS. So when I screen, memang I will get the GBS. Then I will start the antibiotic during the delivery. The GBS is in your vagina. So if the baby go through vagina, then you need the antibiotics. But if the baby doesn't go through, means you do cesarean section and you don't have rupture or membrane, don't have the fluid coming out, we don't need any antibiotics. Okay. And antibiotics during pregnancy is when, let's say, you feel very uncomfortable, very itchy, a lot of discharges, then we confirm it's GBS, then I'll give you antibiotics. Okay. Melissa Low asks, hi Dr. Low, just wondering how accurate is the revised EDD if the baby's measurement does not align with my last menstrual period? Okay. is the SOP. At early pregnancy, if it doesn't correlate with the last menstrual period, we will follow the measurement in the scan, because it is the real baby's length and the real baby's age. And then the last menstrual period, when it doesn't correlate, that is the real age. So it's very accurate. Okay. Jamie Wong commented, "It's very tired and stressful to go KK. I give up visiting KK after this month." Okay, yeah, you can sort of like go there once and then maybe you see how it's spaced out lah. So maybe if you have primary care, secondary care cooperation, you can space out the follow-up with them. Sandra Tan asks, "Can I don't screen for GBS but just take the vaccine to prevent?" There's no vaccine for GBS. GBS is a bacteria, so antibiotics. So some patient, if I suspect, if she has some history, then I will straight the antibiotics during delivery. So there's no vaccine, but we can give the antibiotics. Just that sometimes there's some arguments saying that, if you give antibiotics, then you will change the baby's some microbial flora in the body, then they become like more susceptible for disease, all these things. But so far, there's no problem with that. All right. Okay, Melissa Low asks, "If have past history of GBS, is it the high chance of recurring higher?" Yes. If you have past history of GBS, this time there's no use of screening. I'll just assume you have GBS and I will just give antibiotics during delivery. Jamie Wong say, "I got GBS positive and you cry." No need to cry. Every 4 ladies, 1 ladies have GBS. So if you have GBS during delivery, normal delivery, then we start the antibiotics, then the baby will be okay. All right, the baby will 顺顺利利，长命百岁, no problem. Okay. If C-section, then no need for antibiotics. Yeah, unless you come the time when you come for the C-section, your fluid have rupture. Means when your fluid have rupture, the bacteria can go out. Then you start antibiotics. But anyway, for C-section, we give you antibiotics before the surgery anyway, because we want to reduce the surgical infection. So yeah, you get antibiotics. Okay. All right. So the chat box has stopped. Wow, a lot of questions. I think online class better than the physical class. You're not shy to type up the question, right? Yeah. The physical class usually people more shy because need to speak up, need to hands up. Okay. If you want to speak, you can type there. You want to speak, then I'll open the mic, then you can talk. Okay. All right. Wow, I've gone more than 40 minutes. So the Zoom have given me a special bonus to extend more than 40 minutes. All right. Okay. Any more question about the antenatal? For the delivery, will be next week on the 22nd, the same time, 8:30. All right. And okay, one new message. What is the minimum weight for baby on delivery? Okay. So normal baby weight when delivered is 2.5 to 3.5. Okay, but the safe weight and the gestational age for delivery for a baby is 34 weeks and above and 2 kilo. So whenever your baby has passed 34 weeks and 2 kilo, baby is considered safe. All right. So usually, let's say baby have any growth problem, too small, then our target is to bring the baby up to 34 weeks as close as possible, or better pass a bit, then the baby is considered safe. Okay, safe means it will survive, but then it depends on the baby. If the baby is have lung not so mature, then it may need some oxygen for a few days or something. But it is safer at 34 weeks and above. It's like below 34 weeks, the baby doctor will be like a bit kanchiong. But above 34 weeks, the peace doctor will be very steady. Okay, unless of course the baby have other problem, then we cannot say lah. If it's a normal baby at 34 weeks, the peace will be very chill. Okay, how many kilo we can gain throughout the whole pregnancy? KK say cannot increase at all. My BMI is a little bit over. I think when you are pregnant, we have a hormone called progesterone. This progesterone will increase your appetite. So this appetite will cause you to gain weight. Okay, I think this is a universal problem. Okay, even I'm not pregnant, also I'm gaining weight. Okay, so the thing is that during pregnancy, the weight gain, you cannot drop. Okay, means you cannot reduce your weight. Okay, but if it's static, it's still normal. And for me, usually for me, the normal one is like every 4 weeks around 1 to 1.5 kilo. But for me, for my patient, I don't want you to be too stressful. I would say per month, not more than 2 kilo. All right, because if you imagine you go through pregnancy 9 months, 9 times 2 is 18 kilo. You want to increase 18 kilo in pregnancy. All right. Okay, one more question from Sandra Tan. Is it smaller size person difficult to go for natural delivery? No. Okay, because when you are smaller size, your baby will be smaller as well, and then you will deliver. And then we don't look at the person. Actually, we look at the pelvic. Okay, pelvic. Right. So this is the bone. You can see. Yeah. So we look at the. Okay, yeah. So look at the bone here. So it's like the size here. So the size here, if it's too small or too narrow, then the baby head cannot come down. But of course, if there's a such thing called trial of labor, means that we induce or we let you go into labor and we see how the baby head descend. If the baby head can descend, then you can go for normal. But if the head stuck there, your opening of your cervix is like 5 cm, 5 cm, 5 cm, then it means that you cannot go for normal labor. All right. Okay. So Jamie said, thanks for sharing. Okay. Any more question? So if no question, I will just stop here. Okay. For delivery, maybe you can ask next time. All right. If you are shy to ask, you can WhatsApp. All right. Then yeah, I think that's all. Okay. So thank you everyone for coming. We have a very good crowd today. Yeah. So see you next week. See everyone next week. Okay. Bye bye. Keep safe, yeah. Okay, we come to the end. If you like this video, hit the like button, hit the subscribe button, and smash the bell, and then share it all away.